All right, we're on your side with our weekly visit from Dr. Dave. Today, our medical expert joins us to talk about aspirin and some recent studies of its effects on cancer. Good afternoon, Doctor.
Good afternoon, Mike and Jenny. 3 international studies linked aspirin with a reduced risk of death from cancer and with preventing cancer from spreading. But there are other American studies that have concluded that aspirin does not reduce the risk of cancer.
Okay, so what does that mean? If some
Who
say
do we
yes,
believe?
some say no, yeah.
So current studies show a benefit, but there are older studies that do not. So it's a matter of discussing your individual medical situation with your doctor and weighing the pros and cons. And there are 4 things that folks out there need to know about aspirin. The first is, how does aspirin work? Researchers say it's the anti-clotting and anti-inflammatory effect of aspirin that prevents cancer. The second is, who should be taking aspirin? Not everybody benefits from taking aspirin, and it can harm certain people. Your doctor may consider recommending it to you in certain situations. If you have a family history or a high risk of cancer, for example, Lynch syndrome, which is seen in families with colorectal cancer, your doctor may recommend having you take it in order to prevent cancer from developing.
Don't just jump in and take it. You need to ask your doctor.
Exactly,
first.
exactly.
Okay.
Also, if you already have a diagnosis of cancer and certain other factors of family history, a certain type of cancer, your doctor may prescribe it. And there are folks out there who are already taking aspirin for prevention of heart disease, cardiovascular disease. You want to continue following your doctor's recommendations. The third is how much aspirin to take. This is another discussion between patient and doctor. The current studies suggest that you need to take 3 to 5 years of aspirin daily at a dose of about a baby aspirin. But other studies say that even taking aspirin for 10 years every other day has no benefit. And finally, what are the risks of taking aspirin? There are downsides to taking aspirin, which include bleeding from the brain and the stomach, which can be life-threatening. And based on your medical condition, your doctor may recommend that you do not take aspirin. But if the risks of taking aspirin are lower than the benefits, then your doctor may recommend that you do take it.
It's so frustrating when these studies come out and they contradict each other. You know, one week it's okay to drink coffee, and the next week they say it's bad for you. And
that's right, and it's a matter of having a discussion with your doctor and weighing the pros and the cons based on your individual medical situation.
Okay, good advice from Dr. Dave. She's here every Tuesday on our noon show. If you have a question or a topic you would like her to discuss, just email it to us at newsdesk@cbs47.tv.